Welcome to Texas 2036's virtual series, Straight Talk Texas, where you have a front row seat to conversations on topics important to our future. My name is Enisha Shropshire, Director of Board and External Affairs here at Texas 2036. This special edition of Straight Talk Texas will feature Texas 2036's very own to discuss the release of our new report, Shaping Our Future, a Strategic Framework for Texas. Texas 2036 was founded out of the growing concern that without careful consideration, planning, and decision-making, the tremendous opportunities Texas offers may not exist for our future generations. Shaping Our Future offers a vision and roadmap for Texas's future by measuring gaps and framing key questions to help set priorities to ensure opportunity for all Texans. Guided by in-depth cross-cutting data to inform key decisions, this framework for Texas establishes 36 strategic goals across 7 policy areas. Here to discuss the strategic framework is founder and chairman Tom Luce, president and CEO Margaret Spellings, and director of policy John Hryhorchuk. Tom and Margaret, let's start with you. Between the two of you, there are over 6 decades of policy leadership across many different levels of government. I can think of no better leaders to lead such a consequential effort. So tell us, what inspired this project?
Youth before, well, never mind, beauty and youth before age. Margaret, go ahead, since you're the main author and leader of this effort. Why don't you go first?
Well, we can't start this conversation without recognizing a happy birthday to our founder, Tom Luce. I don't know many people who are octogenarians who unveil a strategic framework for Texas on their 80th birthday. So happy birthday, Tom, for starters.
Thank you.
Obviously Tom is the founder, but I was intrigued by it. And I think all of us who work here and serve on the board or affiliated with Texas 2036, because what we saw was too much short-term thinking, discussions around issues that were often a distraction to the real needs and issues and struggles and strives of Texas families, whether they were education or health, congestion, natural resources, all of those sorts of things. And so when Tom tells the story, he says, he went around and he started asking, was anybody else kind of thinking long-term about these most important things, and found that it wasn't being done really. People were very focused on the legislative session to come, and we needed to set our sights in a little longer horizon. And so that's what we have done here at Texas 2036 being our bicentennial, and setting a set of aspirations that we have for ourselves and fellow Texans across these most important areas, and charting a course and setting sail to achieve them over time.
Well, and you've certainly done a terrific job, you and the team, of pulling together the data, because we wanted this to be a data-driven effort, because we thought it was important to bring together people around facts. And I think you all have done a terrific job of laying the factual basis to then say, okay, based upon these facts, here's where we are today. But then you've so beautifully laid out the 36 aspirational goals, or the North Stars of okay, what do we really want our future to be like? Here's where we are today, but where do we want to be on our bicentennial? And you might talk about those aspirational goals, Margaret.
Well, and I'll ask John to weigh in here too. So we have organized this work around 7 pillars: prosperity and opportunity as major flag poles, tent poles, but also education and workforce, health, infrastructure, natural resources, justice and safety, and something unique to Texas 2036, and that is government performance. How well do we run this $250 billion enterprise we call Texas? And so we have organized ourselves around these important issue areas. We've looked at 57 primary indicators and 110 secondary indicators. We've made those assessments about how we're doing, and we've set ourselves against a set of peers, 11 other states, 12 including Texas, that together make up 58% of the population of our country. And so we are trying to slice and dice the facts and the data in ways that are useful and usable for the public, and importantly to our policymakers around these most important things. And so when people take a look at this data, the framework, they'll see, for example, an aspiration that says Texans have clean air. Can we agree that Texans should breathe clean air. And then we look at data like cities in non-attainment and asthma rates and those sorts of things that really inform how well are we meeting that objective. And that's just one example, but there are 36 goals, as you say, and we'll delve into those as we have this conversation.
But as you know, as you laid out, Margaret, you and I have used this phrase very often, but without data, you're just another person with an opinion. So we wanted to start with data and then say, okay, are we really progressing towards clean air? And then I think the second principle that I'm so proud of is that not only do we set the North Star, but in subsequent iterations, we'll be saying, okay, here are bite-sized chunks of this. You can't reach all of these goals overnight. That's not the way the world works. Mm-hmm. The education system's large. The healthcare system's large. We have a diverse state. So how do we break this into bite-sized chunks? But doing that requires having the data, because you and I both know, what happens is what gets measured. Mm-hmm. So we have to know, are we making progress towards those goals? Because we also know the legislature often passes a piece of legislation, declares victory, and goes home. But if somebody's not measuring the progress, there sure is a lot of law of unintended consequences, as you and I have learned the hard way.
Yeah, and we certainly learned that on education, and obviously the legislature's recently acted, but for about a decade, we were going in the wrong direction. Right. And you know, our remit is to call that out when it happens. One other thing I want to mention that I do think is important is we have all this information. We're trying to present it in ways that are biteable chunks, as you say. And so we're looking at all things children and all things rural and all things around equity. So when we look at the gaps that are being surfaced and that we're paying more and needed attention to around disparities in our policy arenas around education and health and the like, we can have those through lines and look at the needs of children, whether they're in education or health or adverse experiences or whatever.
Yeah.
And then we also have to realize, you know, and we're not oblivious to the fact, despite all this work for a couple of years, that we all suffered an earthquake starting in February or March with this COVID pandemic. And so all of this, you know, we're doesn't change the nature of where we want to be, but it may transform the way we get there. And so this is all very timely. You know, I've had a lot of people say to me, thank goodness Texas 2036 was started, because we're all going to face a lot of changes over the next couple of years. And John, you've been instrumental in helping us develop the COVID tool, and that's one example of the ways that we can step in and use data to inform the discussion. You might want to talk about that a little bit.
Well, I'd like to bring John into the conversation as we kind of transition here. John, you join us from Governor Abbott's office, where you played an important role in policy development, including the passage of House Bill 3, which we've alluded to already during last session. Tell us, you know, and in the report, we identified 11 states that are comparable to Texas in size and business and talent competitiveness that we call our peer states. Tell us how we compare against these states in education.
Well, I think House Bill 3 represented a real opportunity for the legislature to come together and recognize that we weren't where we aspired to be as a state on a lot of important benchmarks, and particularly the legislature really focused in on early childhood education. As we point out in our strategic framework, Texas ranks 12th out of 12 for our peer states in early childhood reading scores. And, you know, anyone who's been tracking Texas politics for the last few years, it's not shocking to hear something like that. But, you know, when people are given the data, able to see clearly what's happening and the trajectory that our state is on, House Bill 3 really shows the kind of a proof of concept of what Texas 2036 is going to be capable of achieving across lots of different policy areas, because you saw a bipartisan consensus form with the business community, with the legislatures, with community groups, rallying around that this was a situation that is not good enough for Texas, and we all want to see it solved, and we will find common ground and drive towards those solutions. And I'm personally excited to see, you know, now we have our indicators built out. We're going to be seeing whether or not House Bill 3 delivers the results, and I think it will over the long term. And, you know, we'll also have to be prepared to pivot if it doesn't.
Margaret, you're our education juggernaut, having served as Secretary of Education and President of North Carolina University System, and just so much knowledge and experience. As has been alluded to as well, COVID has changed a lot in education, both K through 12 and higher education. Given the challenges that we found in the strategic framework, what are your thoughts about how the education system needs to change to meet the current and future needs of our Texans?
Well, it has really brought into the front of mind the gaps that we all know too well, those of us who work in the education arena, the gaps in quality, the gaps in resourcing, the gaps in outcomes that we have before our state. And we Texans have a tremendous opportunity. We're big, we're growing, we're young, we're diverse. And if we play that hand well, we are unstoppable. We will lead the world in enterprise and in innovation. But we will not do that unless we develop our people better. So we have really seen those big gaps brought forward. And when we look at things like broadband, I mean, now, our schools went from, physical plants to being at home every day with families that were struggling to figure out how to educate their own children and do a job and, see about their own careers and the like. And it revealed that we have big gaps there. And so that's why broadband ubiquity and device proliferation has to be before us in the legislative session. Also, that broadband issue clearly has shown us gaps in telemedicine, which is also becoming more prominent. But when we think about schools and how they're changing, there are some real opportunities. Yes, we can have some of our best teachers doing the most important work. We can have other teachers doing coaching. We need to use technology more effectively. We need to engage parents. I mean, I think parents are seeing, wow, my little precious, as I like to say, is behind. And now I'm seeing it in real time as a parent. And so parents are going to be better consumers of education in light of this, I believe.
Yep.
And this COVID, Enisha, to me, just revealed a lot of weaknesses that we knew were there, but it really put them in stark relief. I mean, the weaknesses in our healthcare system, our safety net, the lack of a public health, population health system. We learned real fast that the health of my neighbor really does matter to me personally.
Yeah.
And so I think, it does present us with some real challenges, COVID does, but it presents us with some real opportunities. And that's the reason why I think it's important to have Tex 2036 lead the charge with a long-term plan, because you have to recognize, as I said earlier, you can't change the healthcare system overnight. It's too complex. You can't change the public education system overnight. Goodness knows Margaret and I both tried that, and we broke our pick, as they say. And it just doesn't happen that way. So I think having a plan, and then most importantly, as Margaret talks about so well, we have to build public demand for these solutions. I think it's clear the rhetoric of both parties doesn't appeal to a lot of people who have disengaged from the political process, and frankly don't find that their needs and concerns are being addressed with specifics. Or as I like to say, I've never heard a candidate from either party say they're against education. But I want informed voters and informed funders to say, well, let's talk about that, young lady. Tell me exactly what you're for in education, and then grade their report card. Grade them on health. I mean, let's get down to solving the problem, not just getting elected.
Which our framework does so beautifully. And one of the important differentiators for us as an organization is our understanding of the interconnected nature of our policy areas, which you all have already touched on just in these first few minutes. And COVID has highlighted that fact and how it's impacted so many of our policy areas, but not only in education, and Tom, you've already kind of transitioned us there, but also in health. The report demonstrates that even before coronavirus hit, that Texas's health system was facing major headwinds. So Tom, tell us what you learned about Texas's health system from this body of work that we've done.
Well, I learned that this is more than an insurance problem or a lack of insurance problem. This is access to the right kind of health care when you need it, where you need it. It's moving from a health sick system to a health wellness system, a health care system. It's about moving from treating people in what I call stage 5 of a disease to stage 1 or stage 2.
It's my favorite Tom quote.
Well, it's just so important because, we wait on, we found out on breast cancer, it really does make a difference if you find a lump versus waiting until you need a mastectomy. And, for crying out loud, we need a system that allows people to get the treatment they need when they get it. Right. But listen, this is also about cost, transparency. Just having insurance doesn't necessarily assure you that you can get the health care you need when you need it. And that's just not true in the rural areas. It's true in urban areas. It's true if you have private insurance. So this is a huge, complex issue. But Margaret, I think, has made our theme song, what is that? The hip bone's connected to the thigh bone. And we know that educated people are more healthy people are better educated. You need transportation to get to the doctor, to get to school. It is all connected.
Right. John, along those same lines of talking about our health system, and again, hate to take it back to COVID, but it's just, again, one of those pressing issues that we can't get away from right now. But because of COVID, we responded by creating a COVID-19 dashboard. Can you talk about the challenges that we faced in finding the data to ensure the accuracy and the robust nature of this tool?
Yeah, we've been blessed to have great partners with DISH, the state agency that's been managing public health response, but at the same time, even the agencies can face limitations in terms of what data they have access to, what data they can share, what type of data is being collected out in the private sector in the healthcare or by the various public health entities that are spread across the state. And so when you're dealing with an issue like a pandemic, minutes matter, days matter, and the having to build on the fly is never a good situation under any crisis. You want to be prepared in advance. We were fortunate to be able to step in and help develop our COVID resource, which takes a lot of the state's data and makes it easy to understand, not just for policymakers, but for the general public. And really appreciate Tom's guidance on that if you'd like to add anything, because you're indispensable in putting together that resource.
Well, I would just say, the important thing, and the analogy I use is Hurricane Harvey. When Harvey struck, we had to get people off the rooftops. We had to deal with the tyranny of the urgent. But thereafter, we had to build resilience to make sure we could face the next hurricane. Well, that's what we hope Texas 2036 can be, is a leader in not only dealing with the tyranny of the urgent, but how do we deal resiliency? How do we deal long-term solutions that are better outcomes, less costly to the taxpayer? These are things that make financial sense and personal sense and social well-being sense if we really attack these systemic issues. And unfortunately, people live their day-to-day lives in complex systems, whether they be education, healthcare, transportation. That's why people feel so disconnected from the political process. They feel like their needs aren't being taken into account. That requires systems transformation. That's hard work. It requires data. It requires public demand. It requires perseverance. We're going to have to stay after this for the next 20 years. And that's the reason why we built Texas 2036 to be sustainable. That's why we need people to join this movement. We need your input. We need your financial support. We need you to sign up to get our updates. We're building a movement and a cause that will help Texas really face the challenges of the future. And I'd rather be no place in the world to face a pandemic or anything else than in Texas and the United States. And I believe that fervently. But that's up to us. You know, we like to declare we've been this, we pat ourselves on the back, we're the Texas miracle and all that. Well, I'm a football fan, and I know it's tough to win a national championship. It's really tough to repeat. And that's what we're talking about. Can we sustain the momentum that we've had the last 10 years? And that's up to the next generation.
You're so right. And I'd like to pivot to talk about something that Margaret alluded to earlier that kind of ties it all together, if you will, in a sense, and that's our cross-cutting themes. In the report, we call out 3 of our cross-cutting themes, which are all so relevant today. I'd like to quickly walk through those so that our audience understands kind of what we found. One of those themes that is top of mind for most every person, company, think tank, you name it, is equity. The confluence of COVID-19 and the elevated conversations being had around racial equity places us as an organization in a particularly important position as ones who address policy. So Tom, I'll start with you, but anyone could jump in here, that our data confirms what we've known to be true, where the inequities are in the systems that need transformation in order to address these equities. What does the data tell us that needs to be addressed first? What's the cornerstone of changing these inequities?
Well, first of all, we have to recognize, and I can say this as the old man on this call. Unfortunately, we've been dealing with an equity issue for a long time in our society, whether it be racial, whether it be financial, whether it be low income, whether it be rural. We've been dealing with equities issues too long. And we have to move from conversation, thinking, and listening, which is terribly, terribly important. But we have to move to specific action. And that's the reason why I like to say Texas 2036 is a think tank, it's a do tank, and it's a watchdog tank. I mean, we need to move to action. And a lot of the issues that we face on the equity front require both state action and local action and change of hearts and minds. And that's going to require all 3. And we're going to be leaders in all 3. And I like to say, when bottom up meets top down midway, and the public's behind that, then we can produce real change. And that's what I hope I live long enough to see, because goodness knows it's needed.
Yeah. And Enisha, I think, it starts with expectations. Our former boss used to talk about the soft bigotry of low expectations. Mm-hmm. And that is why our aspirational goals are so important, because candidly, we haven't had high expectations for our poor and minority students, and so that we just have to decide as a state, do we care that everybody has the opportunity to be successful in the economy? Everybody has the opportunity to be healthy. Everybody has the opportunity to breathe clean air and have clean water and all those sorts of things that are just our expectations. And so when we start with that as a clarion call around these 36 goals as a starting point, then we're blocking and tackling around how to get there. If we don't think it's needed, as I like to say, if you don't have a problem, you don't need a solution. And so the beauty of COVID and this moment in our state's history and in our nation's history is it is elevating in stark realities what is before us and our expectations of each other to get after it.
Yeah.
And I would just close with this. I really think the essence of all of this is, are we really serious when we say we want every person, every child to have a true equal opportunity in every sense of the word? Are we going to do the blocking and tackling necessary to make sure that our kids, for instance, and people in the rural areas or people in urban dense areas or whatever, line up at the starting line with an equal opportunity, equal access equal opportunity to better health, better opportunities to education, transportation. I mean, on and on and on. It is the essence of equal opportunity, is to turn it into a reality.
Right, and equal opportunity means removing barriers that are in place and making sure that when they are at that starting line, that it's equitable, that all the things that could prevent them from, as you like to say, achieving that success that is so available in our state, that they actually can have the opportunity to achieve that. You talk a lot about, you've mentioned several times about rural, which is our second cross-cutting theme. What are some of their more specific challenges that may be different from urban areas that our rural Texans face?
Well, broadband, clearly, we're seeing, the issues there. We've always thought of that as a rural issue. It's an urban issue too, but water systems are not adequate. Obviously, transportation can be a challenge. Rural hospitals, our healthcare systems. This is why telemedicine and broadband are critically important. So it's a different set of issues. But again, do we have that expectation that every single Texan is poised for success? Not only is that the right thing to do, but it's the smart thing to do. Because when we develop every single Texan to their fullest potential, we are completely unstoppable as a state and as individuals.
Right. And many of the issues are identical. The tactics may be different depending upon where you live. We're a very diverse state, but everybody, we need to focus on healthcare for everybody and educational opportunities for everybody and infrastructure for everybody and water for everybody. And that's the reason why we could agree upon 36 aspirational goals. So, Margaret, I just want to say thank you for all you've done and all the team has done, John, and the whole, this was really a gigantic effort that you all pulled together. And I just want to conclude by saying thank you. I think future Texas generations will thank you. And Enisha, thank you for convening us.
Absolutely.
Tom, thank you for your leadership. I too want to commend the team, but none of us would be here without you. And I hope we'll together make a major contribution to the future of our state. And I look forward to working with you and this amazing team to do just that.
Thank you.
And thank you all for your work. It is truly my pleasure to be able to work alongside you to bring about, to effectuate change in our state like we haven't seen before. And I thank you all for watching Straight Talk Texas. The full framework and its indicators can be found on our website at texas2036.org. And to raise awareness about the 36 goals identified in shaping our future and to bring Texans together behind a platform that promotes prosperity, we encourage you to add your name to support these goals. Visit texas2036.org and to sign up and stay informed. And you can also provide feedback about Straight Talk Texas by emailing us at straighttalk@texas2036.org. Until next time, wishing you and your family well.